That's right. I think that's very well put. I mean, most of the people, and when I say most, I mean 4 out of 5 people who get this Zika infection will have either no or very few symptoms. They may not even know that they were infected, and they'll develop their own immunity to it. So if they ever get exposed to it again, they won't get an infection. So that's sort of the good news. But again, you're right. It's this situation with the birth defects that has really captured attention, and understandably so.
And another mosquito-borne disease similar to West Nile fever and dengue. So the whole issue is mosquito control, and with climate change affecting us so much, areas that weren't as wet and weren't as warm are changing. I guess that's causing fear in parts of the United States as well.
Yeah, you know, El Nino and the weather patterns, you know, are probably in part what's driving this in South America. You have more mosquitoes, you have more water, as you point out. You know, it's interesting when you look at this now, you think about the United States, you think about dengue fever. It's a good example, Doc, because it's transmitted the same way, same type of mosquito. And we do get cases of dengue in the United States, but not many. It's not a widely circulating thing in the United States by any means. And I think there is, in part, some good news there. Even if this comes to the United States, simple things, this may almost sound silly, but simple things like screens on windows, air conditioning, which is obviously much more widely available in the United States, and particularly southern United States, really keeps a lot of these mosquitoes from causing the same sort of numbers that we're seeing in places like Brazil.
And it is something where, you know, the World Health Organization is saying that this will most likely spread to most countries in the Americas. Right now, though, it is mainly going to be Central South America, the Caribbean. These changes to climates are very interesting, and I've often talked about it. I had a particular interest in this when I was in medical school, and I actually, my senior year of medical school, started a class called Human Health and Global Environmental Change, because this was really before a lot of these changes were occurring. I think this is a subtle reminder to everyone that we need to pay attention, because these movements and patterns of mosquitoes, as an example, it's not just this virus, it's so many others that could come to the United States. Just to clarify for people, there have been cases reported in the U.S., but these were people who had traveled, correct, Sanjay, to these countries in the Southern Hemisphere?
That's right. They traveled there and then came back to the United States. So they didn't get the Zika virus in the United States, and that's really the important point. When you look at these things, you want to say, is it circulating within a particular place? You may have cases, as you point out, Travis, but it's not circulating in the United States.
Well, these recent cases in Brazil are putting sort of Brazil in the hot spot, especially with the Olympics coming up, and doing everything they can. As you said, it's all about trying to control the mosquito population and those factors that contribute to their breeding.
And let me ask you guys this, because one of the things we love to do on The Doctors, as you know, is give our opinion. El Salvador has been advising women not to get pregnant until 2018. I'm just curious what your thoughts are on that.
That's going to be a hard one to implement.
Yeah, how does that work?
This seems like it's a bit reactionary. That's going to create a little
pandemonium, I think.
Well, and obviously people need to keep all this in mind. We've got Carnival coming up, the Olympics in Brazil. Apparently, Brazilian military is going door to door distributing repellent. I think, you know, for individuals, obviously, Sanjay, is the message, if you've traveled to one of these countries and you're pregnant or thinking about becoming, you know, then you obviously, if you are concerned at all, talk to your healthcare provider. But for right now, is this more so for us in the United States, just keep paying attention?
Yeah, I think, you know, we got to keep an eye on this. I think we'll see more cases of Zika in the United States. People shouldn't be alarmed by that, again, for the reasons we talked about. We're going to see those people returning. I think the advice, and from even the Centers for Disease Control, to if you're a pregnant woman and you're thinking about going to Brazil, if you have to go, you go. But if you don't have to go, you probably shouldn't right now, because there is this concern that if you get an infection with the Zika virus, you could have these problems. So, you know, there's no travel restrictions by any means, or I don't think we're going to see any kind of travel restrictions. But I think it's common sense, like you're saying.
Yeah.